serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're on today with Dr. Keith Robinson. He's a pulmonologist. You'll recognize him from before. We've had him on the show many times, as well as joined us in studio. Obviously, we're doing tonight's show remotely. So I want to get right to it, that we got a lot of information to tackle. Dr. Robinson, how are you doing this evening?
I'm doing fairly well. Thank you for having me on this evening.
And thank you for joining us on this health show. So let's get right into it. With COVID cases on the rise in Miami, an area that you've specialized in for a long time, including right now, why is the ventilator supply discussion critical right now?
So it's a really good question, because I think the confusion that's created is the folks with COVID-19 will go into a unfortunate injury to their lung that requires them to need some assistance with their breathing. And we recognize that we have a shortage of mechanical ventilators across the country, not just here in South Florida, in order to support these patients when they get to the point where they need some assistance with their breathing. So our initiative looked very specifically at common devices that are found in facilities. Some folks, when they've had trouble breathing, have had to be on a BiPAP device, bi-level positive airway pressure device, in order to help to stabilize and help them breathe more comfortably. And so when we started thinking about what the mechanics of a ventilator would do for a patient, and more importantly, what a BiPAP device does, we found that there are really the same type of device in that they both provide some level of positive air that will help patients with breathing problems. And our initiative intends to do as the World Health Organization has instructed, which is to do early intubation with our patients so that we can protect our healthcare workers.
So a couple of questions, Dr. Robinson, on that. So these BiPAP devices, so I'm a member of the general public. Obviously, I don't have any medical training, but are these similar to like what you'd find with a sleep apnea machine? Is that a BiPAP machine?
So there are some machines at home that patients have used for sleep that are BiPAP devices. And there are some machines called CPAP devices that patients use to sleep if they've got some level of sleep apnea or heart failure. What we're discussing is a BiPAP device that would be found within a facility. So a bit stronger in regards to the amount of pressure that it provides. And BiPAP devices would provide two levels of pressure, not just the one level of pressure that a CPAP device would provide. So you need a little bit stronger device, and you need a device that actually could provide not only 100% oxygen in some patients if required, but also two different levels of pressure in order to help patients breathe and also to oxygenate.
So that's a great explanation. That's helpful to understanding it. So there's a lot of information on Facebook. It's the and I don't have it in front of me, but it's the COVID-19. I actually got an alert for it last night. The COVID-19 BiPAP. So tell us a little about your involvement with that and how that's getting the word out.
Well, thank you for that question. So, even though I'm still a practicing critical care physician in South Florida, I'm a medical director at a company called Syneos. We are a product development company, and we saw that there was a need to solve the solution that, at least in regards to helping people get through this pandemic. So we put our expertise together. That expertise led to a team of wonderful people that I work with at Syneos, and we've put together a webpage, www.covid-bipapinfo.com. And on that webpage, we put two algorithms. I think the idea that many clinicians and many healthcare workers have used BiPAPs in the past means that they're going to be familiar with the modes that these machines can provide to patients. And so we wanted to put on that webpage a brochure and a video instructing clinicians and healthcare workers how to titrate and move the adjustments on the BiPAP device necessary to help patients after they've been intubated in order to breathe more comfortably and stabilize their breathing concerns with the COVID-19 virus.
Yeah, it's a great resource. I've been on it a few times since last night. Again, we're here with Dr. Keith Robinson. He's a pulmonologist with Syneos Health Miami, and we're going to talk a little bit more about that a little later. I do apologize if, Dr. Robinson, you're getting a feedback or that I may be causing. We've been doing this remotely for just a few weeks now, and there's a couple glitches. So just want to make sure. Doctor, if you're just on the phone, that's fine. If you have the computer on and the sound up, that may be causing a little bit of a feedback. If not, it's me over here, which I'm trying to turn down now. But I'll just go on with the audio. Now, so we're kind of jumping around, but I have a lot of things I want to talk to you about. What can area hospitals do to prepare to address the need to support COVID patients? Because as there's a lot of news stories going around, seems like, we haven't peaked here, and there's still, I can't say for every hospital, but there's a lot of beds open. So what can hospitals do now to prepare?
So that was the one thing we wanted to make sure that every healthcare worker out there was aware of our program, was that we had time in order to make sure that we had not only the ability to prepare, meaning that all the BiPAP devices that are currently located in healthcare facilities are purposed and ready to be used for patients, but also to make sure that the education was provided. So that webpage I gave earlier, the www.covid-bipapinfo.com, was our attempt to make sure that every healthcare worker had the tools and education necessary in order to ensure that when patients do start arriving in numbers to the facilities, that they're prepared to save them, and more importantly, prepared to provide those mechanical ventilators that are currently in facilities, provide them to the gravely ill, because I think in some patients that aren't as sick, our initiative, our BiPAP initiative, should hopefully stabilize some lives and keep people from having bad outcomes unnecessarily.
Yeah, that's great news, because obviously we want to save as many lives as possible. Yeah, we're good now. Thank you, Dr. Robinson, for bearing with me. I haven't done this remotely too many times, and it sounds like I got rid of the feedback, whatever I just clicked. So I do appreciate it if that was a little much there.
No, it was fine.
Tell us a little bit. Oh, go ahead.
No, I said the feedback was fine on my end.
Oh, good. It's me over here. And I caused it as well, so I think I've made that obvious. Tell us a little bit about last time we talked to you. You obviously been in this area for a long time as a pulmonologist, but now you're with Syneos Health Miami, and it's a little different because you're doing not only care, but is it testing as well? Can you explain a little bit about your role?
Yeah, so my role with Syneos Health, we're as I said, a product development company, which is essentially we are the nuts and bolts of some clinical research trials, so pharma trials, in order to get medications to the patients who require them. We like to say shortening the distance from lab to life, meaning that we really try and make sure not only that we've helped to develop that product, that medicine, if you will, to patients, but that we've also got a commercial side. And that commercial side helps us to do some of the things we've done with this initiative, which is do some outreach and I think help folks understand and recognize the benefit of the products that we've developed. And so for me, I'm kind of back channel at this point in life and training. I'm actually helping to bring medications to market that are hopefully going to save lives and more importantly, improve the quality of life of folks that I used to treat in office.
That's great news. And yeah, we're so glad to have you again. I got one quick question before the break, and then on the other side, we're going to talk a little bit about gloves and masks and the virus itself, because I know you're a pulmonologist. You probably understand this better than anyone. So I just there's a lot of debate right now going on about gloves and masks. So actually, I want to take a quick commercial, and on the other side, talk to you a little bit about that. So stay on, Dr. Robinson, on the You and Your Doctor radio show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back to the You and Your Doctor, Living a Longer and Healthier Life show. We're here with Dr. Keith Robinson. He's a pulmonologist. Syneos Health Miami is the name of the group, and he just explained a little bit about what he's doing with them. So we're so happy that he could join us, and they helped us out as well. So really appreciate this. Dr. Robinson, a little before the break, I was kind of teasing into gloves. I know there's been a lot of back and forth on how long, gloves should be used. Obviously, a lot of us aren't trained in the medical, arena, so we don't really, we're kind of just learning on the fly here. So if you would tell us, the proper way to put on gloves, wearing gloves, how long we should wear them, when they need to be changed, etc.
So I think the misconception about the gloves in specific is that it will protect patients directly from getting the virus. And let me clarify that, because the glove will confer some protection as long as you don't auto-infect yourself, meaning you don't take what you've touched with the glove on and then touch your face, touch your nose, touch your ear. So what I would tell my folks, if they're going to wear gloves out into the community, you really only want to wear them when you're going to be in a public area where you're going to be interacting with maybe staff, or if you're at a grocery store picking things off the shelf, meaning you're not aware of whether there's viral particles on those objects. But once you leave the store, you got to take the gloves off, because if you've touched the virus and that virus is now on your glove, that glove's going to make it into your car, make it onto the things that you would touch in the car. And then if you forget to put your gloves on getting back into the car later that day, then you're going to infect yourself with the virus. So once you go into a closed location, like a store, if you go to the pharmacy and you have your gloves on, you want to make sure you take those gloves off after you leave the facility. And then clean your hands with an alcohol or a hand sanitizer if you can as you walk out the store, so that you can, again, disinfect your hands before you touch your car. Because the concern is that you don't want to carry that virus with you into an area that should be free of virus, like your automobile or your home. And I think that leads to maybe the mask, too. It's the same with the mask. The mask does not, in and of itself, prevent you from getting the virus. It may decrease the chances that you'll inhale or get some of the particulate into your lung and cause infection. But if there's virus on the outside of that mask, if you touch it with your hand, you're going to, again, probably inadvertently touch your face, your nose, and your eyes, and then now you've infected yourself with the virus again. So you have to be careful with the mask in regards to when you put it on, and more importantly, if you touch it, that you have to clean your hands before you touch anything else. Because if there's any virus on top of the mask, then you don't want to touch it with your free hand, or more importantly with your glove, and then forget it's on your glove. So it can be really confusing about how to take these things on and off, and I just want folks to be really cognizant of the fact that this virus is a sticky virus. So it's going to stick to a lot of the things we touch, a lot of the surfaces that it comes in contact with. And so you're going to want to make sure you've taken off the things that might have come in contact with any surface, and then more importantly, don't infect yourself by forgetting to take the gloves off appropriately, meaning as soon as you leave a store, so that you don't take the virus into your car or into your home.
That's great info. We're here with Dr. Keith Robinson, pulmonologist. So one of the things that you said there has made me understand this virus in the last 24 hours better than I've understood it in the last 24 days, is that it's sticky. And I think that's a great way of explaining it to, the general public, because it's gonna, like you said, it's gonna stick to whatever it's on, it's going to stick to. And then if that gets into your home or car, like you said, and into your mouth, or I've heard even mucous membranes, then it can cause infection, like you said. So that is a great way of explaining the virus as it's sticky, and the reason why it becomes a major problem. I think that early on, if we had heard that a little bit more, we may be in, hopefully, maybe a different, predicament, but who knows? But I think that what I want with the point I'm making, that's a great way to, explain it to the general public. So that with the gloves and masks, yeah, it's important there, that everyone, reuses them, and what Dr. Robinson just said. Let's talk a little bit about the actual disease, Dr. Robinson, if you don't mind, the actual infection. So you're a pulmonologist. Your understanding is obviously vast on this. So it affects the respiratory system. How does it affect with people with underlying health conditions? Because we've also seen a lot of reports of younger patients as well. And I feel like in the last 2 weeks, it's kind of been a little bit more news about younger patients coming out. So can you explain a little bit about how it affects, I guess, age?
Yeah, so we're really talking about all the folks in the world that are susceptible to this virus. I mean, there's no natural immunity to it. It's just unfortunate that some of our folks, and the way we would describe it currently is that you either have the ability from an immune system standpoint to fend off the virus, or you're going to have lost the ability to defend a virus of this nature. And that, unfortunately, is our older population of folks where their immune systems are just not as robust as they were when they were younger. And so add on top of that, having chronic heart disease, having some kidney concerns, having some lung problems, then that really causes folks who may not have the immune system necessary to fight off this virus to be at greater risk of losing their life prematurely. And that's what we've seen. But to your point about younger patients, we have two populations of folks that we worry about that are under the age of 65. So the young folks, college children and kids, am I that old? College folks that came down, they're just at risk of having a bad outcome as anyone else. It's just they have a more robust immune system. And so they're going to be able to make the machinery necessary to fend off this virus a little bit better. than some other folks. And then at least to our other population of folks my age, our middle-age group, where unfortunately we have some chronic illness like high blood pressure, like diabetes. And in that population of folks, what we're really talking about is what is the risk factor for that virus to cause a relatively healthy middle-aged person to not do quite so well. And what we find is what the common denominator between high blood pressure and diabetes is, which is atherosclerosis or hardening of the arteries. So I think in relation to your question, what we're talking about are risk factors for chronic inflammation. So anybody that has any illness that's likely to cause them to have chronic inflammation, asthma is a chronic inflammation, COPD, another chronic inflammatory disease, having too much weight is also an inflammatory process. So anybody that has chronic inflammation is at risk for this virus to cause them to, unfortunately, not do very well. So it really does lean on for folks to have a really good, strong, robust immune system to fend off the virus if they've got chronic illness and chronic inflammation.
Great information again, Dr. Keith Robinson here, pulmonologist. We're so lucky to have a pulmonologist on this show because they understand this and they have a grasp on this like no one else. Dr. Robinson is with Syneos Health Miami. I'm going to give out the number 954-858-5511, and we'll give that out again as well. So another thing is social distancing, and I can tell you, I've been in the house here. It's probably why I'm stumbling on a lot of my words today. I haven't been out in about 3 weeks, so getting a lot of deliveries, etc. So I know there's a lot of essential people who need to get out every day and go to work in essential jobs, and that's understood. But coming from a doctor, and I've heard this from many doctors, I work with doctors. As a doctor, why is social distancing still so important, whether, no matter what age you are, for the general public? So, if we can stay home, we still need to stay home until, we get through this, and hopefully that's not too long down the road. But I just wanted to ask you that and share your views on that.
Well, I think from a social distancing standpoint, we know that you're less likely to get infected and get sick if you're not standing next to somebody that's currently ill with the virus. We know that a radius of at least a meter or at least a yard is primarily where the viral particle, if someone coughs or sneezes, will fall. And so if you place yourself at 6 feet away from everybody, you're less likely to step inside of that I guess, the paper bag of illness, if you will, for folks who are actively infected. But it also lends itself to what social distancing actually means, which is if you're distancing yourself from an ill patient, you're going to keep yourself far enough away from the infection where you don't have to worry about touching a substance or a table or touching a doorknob or even a window for getting the infection. So the idea is that if you minimize how close contact you are with folks, you can minimize what surfaces you're likely to touch that an ill person probably would have left some of the viral particles on top of. So it speaks to two things. One, the behavior of the virus, how far you have to be away so that you can ensure you don't, if you're near a patient that's ill, catch the virus. And the other is the surfaces that this virus will sit on. So if you're not sitting close to somebody who's sick, you're less likely to touch the surface that patient may have or that person may have placed the virus on top of. So that's why social distancing works. It's to keep people from being in close contact with people who are actively infected.
Yeah, and then, the longer we can social distance, we can keep people out of the ERs and the hospitals and hopefully not, flood them over the next few weeks. Dr. Robinson, we have about a minute left. So again, I want to go back if anyone missed it, if there was a little feedback in the beginning. Tell us again about that COVID-19. I found it on Facebook. You shared a URL. Tell us again about it. You have less than a minute.
Yep, so if folks can go to www.covid-bypassinfo.com, they're going to find our information about using a BiPAP device that's found in facilities. And we recommend doing early placement of a breathing tube so that we can protect our healthcare workers and stabilize patients who are becoming short of breath.
Thanks again, Dr. Robinson. We'll have you on anytime. If you'd like to come back on, again, it's Dr. Robinson, Keith Robinson, Syneos Health Miami, 954-858-5511. Thanks again, Dr. Robinson.
Thank you very much for having me. I appreciate it.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.